آله وأصحابه ولا رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. Assalamu alaikum wa rahmatullahi wa barakatuh, everybody. Welcome to a very special event that we have today called Diabetes and Ramadan. We're really honored to have Dr. Tayyab Khan with us here. He's the Associate Professor of Medicine at Western University. He has been involved in formulating recommendations for fasting with diabetes during Ramadan through Diabetes Canada and International Diabetes Foundation. He's presented this to various communities in the GTA before, and we're really honored that he is sharing this information with us in a very timely fashion because Ramadan is just around the corner. Without further ado, I'll turn it over to Dr. Tayyab Khan. If you have any questions, please use the QA, like ask a question tab, and then inshallah we will get in that manner. Dr. Tayyab, please take it away.
Assalamu alaikum, everyone. Thank you very much, Jazakallah, Maulana Saab, for inviting me and providing me with the opportunity to present today to you. As you've mentioned, Ramadan is around the corner. So my name is Tayyab Khan. I am on faculty here at Western. I've been involved in diabetes and Ramadan, and fasting, particularly for patients with diabetes during the holy month, for a few years. So wanted to take this opportunity to help, share some thoughts with some of you who may find them useful. I'd be happy to take questions at the end, so feel free to ask questions, and we'll basically address them at the end. I have no disclosures relevant to this presentation. I have been, as Imam Saab mentioned, a member of the Guideline Development Committee for the first Canadian position statement for patients with types 1 and type 2 diabetes who intend to fast during Ramadan. So this was published a couple of years ago. And more recently, the International Diabetes Federation has come up with the practical guidelines for diabetes and Ramadan, and I was fortunate enough to have been a part of that as well. So we'll briefly talk about, the scope of the issue, why this is important. We'll talk about some of the risks associated with fasting during Ramadan in patients with diabetes. We'll talk about some strategies to mitigate those risks. We'll talk about situations in which the fast should be broken. Briefly, I will touch upon some of the medical benefits on fasting at the end. I am by no means an expert in religion, etc. So I will focus on some of the scientific evidence that we have available in this regard. So why is this important? So here is a map of some of the Muslim majority countries. This is by no means all exhaustive, but the prevalence of diabetes is much higher in Muslim majority countries compared to what it is here in Canada or throughout North America. So if you look at this map over here, the prevalence of diabetes or the percentage of people diagnosed with diabetes in these countries is much higher. So for instance, data from the Middle East, countries like Saudi Arabia, the prevalence of diabetes is upwards of 20 to 25%. The South Asian countries, Pakistan, India does have a significant Muslim population, Bangladesh. Over there, the prevalence of diabetes is roughly around 13%. Compared back to Canada, over here, the prevalence of diabetes is roughly around 6%. So this is a disease condition that does tend to affect us, coming from the Muslim world disproportionately compared to the average populations here in North America. Now, what is the prevalence of diabetes among Muslims in North America? Since, as you're aware, data is not gathered on religious lines. However, it's sort of gathered in terms of ethnic lines. So these are American data, and our Canadian data are similar as well. Among South Asian patients, who basically resided in the United States, the prevalence of diabetes was roughly around fourfold higher compared to the majority Caucasian population. Among Arab Americans, once again, it was around 3 to 4-fold higher as well. So 15% among women, about 20% among men. So since a large part of our Muslim population, is either first or second generation immigrants from countries in the Middle East or in South Asia, it would be not a stretch to believe that the prevalence of diabetes in us is higher compared to that in the general population. So that's the reason why it is important, and it is important to talk about these issues. So how many of us tend to fast during Ramadan? So, essentially there's two main types of diabetes. Type 2 diabetes, which is mainly a disease of insulin resistance. So it is associated with obesity, slightly older age, stronger family history of diabetes. More than 90% of patients with diabetes have basically type 2 diabetes. So this is a condition where initially patients only need oral medications. Eventually, over course of time, people do require insulin. So among these, up to about 80% of patients did fast for at least 15 days during Ramadan. The other kind of diabetes is basically type 2 diabetes, where it's basically a disease of insulin deficiency, where patients need insulin right from the get-go. They need insulin with meals. They need insulin just to keep them stable as well. So these are folks who are on multiple daily injections of insulin. Even among these, roughly around 40% of them tend to fast for at least 15 days during Ramadan. What are the risks associated with fasting with diabetes during Ramadan? So they are essentially fourfold. There's something called hypoglycemia, or a risk of low sugar episodes. So when sugars are low, typically 4 or less, people can have symptoms, tremors, shakes, palpitations. If it goes unnoticed, people can have seizures, etc. So that is a risk that's present during the fasting hours, particularly when Ramadan comes, in the summer months. Now, right now, it is coming in spring, and each year, as you know, it will be coming 10 days prior to the previous year. So these risks are sort of magnified when Ramadan comes in the summers, and are sort of minimized when Ramadan falls in the winter months. Then there's the risk of hyperglycemia. So people can have high sugar episodes when sugars are 15, 16 or higher. Patients, they tend to become dehydrated. They have other risks associated with it. So there's a risk called diabetic ketoacidosis. What ends up happening in that scenario is that the body starts making use of fat as fuel rather than glucose as fuel. And the byproducts of it can be harmful for the body. So, that's a condition called diabetic ketoacidosis and requires hospitalization. When sugars are high, one is prone to dehydration. One is prone to developing blood clots as well. So those are some of the risks that can be associated with fasting. And in addition to the long fasting hours during the summer, patients' overall glucose control, the medications that you're taking, the level of physical activity that may predispose you to developing dehydration, all of these factors can somehow increase your risk of developing these complications. So since even before we formulated our own position statement for fasting with diabetes during Ramadan, there was a guideline by the International Diabetes Federation, and they've presented another one this year. So why did we have to come up with our own position statement? Well, the reasons were several, and our position statement derives most of its information from the International Diabetes Federation guidelines. But there are some situations that are a bit unique to Canada. There's a tremendous variability in the fasting hours. As we all know, during the summer months, fasting hours can be, 17, 18 hours sometimes, depending on where you live here in Canada. Whereas in the winter months, they can be as short as 12, 13 hours as well. So there's a tremendous variability in our fasting hours. So the risks that I've talked to you about can be much higher when fasting hours are longer, and they can be lower when fasting hours are shorter. In some of the Muslim majority countries, or countries in which Muslims comprise a sizable population, they do tend to get accommodations for work. They're changed in work hours. Work hours are often shorter, but that's not the case, here in North America. So that's why we felt the need to come up with our own position statement. We have medications that are safer compared to those available in some of the Muslim majority countries or some of the Middle Eastern or South Asian countries. So, the availability of those medications, if anything, decreases our risk of some of these complications as well. And then finally, much of the research that has been done in terms of fasting with diabetes has mainly been done in some of the Muslim majority countries. And there is little data. It is emerging though, but there's little data that is unique to Canada. So that's why it is important to evaluate those data and see if they fit, in our situation or not. So that's why it was important for us to come up with this position statement. So that was the rationale behind coming up with this statement, and we formulated it and it was published. So most of the information that I will be presenting, is derived from this statement, but there have been, some newer information, and I will specify it as such as we go along. So the first thing is to basically stratify one's risk for these complications during Ramadan, and that's why it's important to seek care with your healthcare practitioner, roughly around 2 to 3 months prior to the start of Ramadan, so that you know what your risk is. So, there's basically a risk score, and, I won't go into all of these details, but essentially the kind of diabetes you have, if somebody has type 1 diabetes where you're needing multiple daily injections of insulin, your risk is a bit higher compared to somebody with type 2 diabetes. If you've had it for a long period of time, more than 10 years, it is quite likely that you may develop some of the complications that are associated with diabetes and may have a higher risk. Somebody who's had hypoglycemic episodes, so low sugar episodes, even outside of Ramadan, it is not a stretch to assume that their risk would be magnified during the fasting hours. So that's why their risks would be high. It depends on the kind of treatment you're on. If you're requiring multiple daily injections of insulin, you're at a higher risk. If you're only requiring oral therapy, that does not reduce your risk of low sugar episodes, this risk is lower. If your glucose control is not optimal, for instance, if there's a parameter called hemoglobin A1C, which is basically roughly a 3-month estimate of blood sugars. So if it is greater than 9, then your risk is higher. If it is within, targets or close to targets, this risk is low. If somebody has, major vascular complications like a heart attack or a stroke, particularly if they've had it within 3 months of the fasting period, their risk is high. If somebody has had advanced kidney disease, their risk is high. When we talk about some of the other acute complications, if you have been hospitalized because of those complications within the last 3 months, the risk is high, while if you haven't had them, the risk is low. If somebody is monitoring their glucose control, their risk is lower, but if somebody is not monitoring them, the risk can be higher. Similarly, if somebody is involved in physical labor, that risk is higher, particularly because of low sugar episodes as well as risk of dehydration. When fasting hours are longer, this risk can be higher. If somebody is old, frail, these risks can be higher. And finally, in the last Ramadan, if you have had, some of these complications, your risks would be higher. Pregnancy, as we know, so pregnant ladies need not fast, but some still do. So, if they're above their targets, their risks are higher. If they're within targets, their risk is still higher compared to somebody who's not pregnant. So, we came up with this score. If it's 0 to 3, they're at low risk. If it's greater than 6, they're at high risk, and between 3 to 6 is basically a moderate risk category. So those who are at low risk, as shown by the green here, can fast under medical supervision. Those with scores greater than 6 are at high risk, and we made a recommendation that they must not fast from a medical standpoint. In the moderate risk group, we made a recommendation that they should not fast, realizing full well that a lot of these patients still choose to fast, and we can help support them through medication changes, through and through monitoring their glucose control, etc., so that the risk of these complications can be minimized. How does glucose change during the fasting hours? And this slide basically, shows that. So as you notice, in the blue graph, is change in glucose control in the non-fasting hours. So that's basically, sugar, glucose goes up after eating. We typically eat 2 to 3 meals during the day, and you do notice an increase in blood sugars after eating. During the fasting hours, as shown by the red graph here, what happens is that at suhoor, shown here in the graph between 4 to 5 a.m., the sugars do increase. And then after that, since we're not eating and drinking, the sugars continue to fall, and they reach their nadir or their lowest point close to iftar. So that is why it is important that we check our sugars. And if there is one point that we should be checking them at, that is before iftar, because at that time, our risk of low sugar episodes is at its highest. And if somebody is having, significant low sugar episodes, then one should reconsider their decision to fast, because, it can be dangerous. And this risk is magnified in people who are on medications, that increase their risk of low sugar episodes. For instance, somebody taking insulin, somebody taking oral medications that can cause low sugar episodes, this risk is higher. Whereas if somebody's only taking oral medicine, their risk is not as high as the other person. And conversely, since iftar meal does comprise significant amounts of carbohydrates, there is an excursion or an increase in sugar levels after iftar. So that's why it's important to have sort of a balanced, meal at iftar, so that we can reduce the risk of having high sugar episodes right after iftar. There is a common misconception, and I did not know of this until I got involved in formulation of this position statement. And this is prevalent, throughout the Muslim world, that monitoring blood glucose levels through the finger poke test could invalidate the fast. And, this is one area where we have sought religious opinion from imams here locally, at the Islamic Society of North America, as well as internationally as well. And they have mentioned that monitoring blood sugars through the finger poke test does not invalidate the fast. If anything, there are studies that have shown that monitoring blood glucose levels frequently can increase chances of fasting safely and reduce risk of having to break one's fast during the month of Ramadan for those with diabetes. So it is important that we monitor blood sugars just to make sure that we are monitoring them to reduce risks of low sugars and high sugar episodes. How frequently should one monitor it? That is dependent on several things. For most people with type 2 diabetes, just monitoring it 1 to 2 times during the day is okay. Those who are on multiple daily injections of insulin, monitoring them, 3 to 5 times during the day is what's recommended. But it has to be individualized. Now we do have some of the continuous glucose monitors. You can basically put them on your arm or on your belly, and they provide you readings for about 10 to 14 days. So that's an easier way to monitor blood sugars. But, for those who don't have them available, it should be individualized. So in most cases, if you're just taking oral medications, around 2 times during the course of the day, one of them should include just before iftar, and those who are taking multiple daily injections, around 5 times during the course of the day. I will just present briefly a few slides on some food groups. So there are essentially 3 what we call macronutrients, one of them being carbohydrates. There are principal sources of energy. You find them in grains and starches. You find them in fruits. You find them in ice cream, some dairy products, and sweets and candies as well. So patients with diabetes are not able to use their carbohydrates to the best of their abilities because either insulin is resistant, they have insulin resistance, or they have deficiency in insulin. So how much carbohydrates to take? So basically the size of your fist. So size of your closed fist is how much carbohydrates you should be taking. If it's rice, basically 1 to 1.5 cup of rice. If it's roti or pita, basically 1 to 1.5 normal sized roti. If it is bread, 1 to 2 slices of bread at each meal is what's recommended and should be enough. Then there is protein. So proteins are basically our main building blocks, if you will. So, they're present in all kinds of meat. They're present in grains, legumes, etc. as well. So how much protein should one have? So basically it's the size of your palm. So, basically the size of your palm, no thicker than the size of the pinky, is what we recommend. And these suggestions are the same for both during as well as outside of Ramadan. Basically, green leafy vegetables, you can have them. They're excellent sources of fiber, very little calories, very little carbohydrates. You can have 2 handfuls of those. They are filling. They are beneficial for those with or without diabetes. Excellent sources of fiber. You can basically take them, however much you want. But for a balanced meal, we recommend basically 2 handfuls of these. Finally, fat sources. So we recommend taking no more than the size of your thumb as fat sources, both during as well as outside Ramadan. And here's how it comes together. In a balanced Ramadan plate. This is for iftar, but it can be similar for sahur as well. So 1 cup of green leafy vegetables, as I mentioned, there's very little calories, very little carbohydrates, excellent sources of fiber. So have as much salad as you want. A source of protein, as has been mentioned, and you can combine, plant-based sources as well as animal-based sources. So a cup of you can have half a cup of beans, lentils, peas, etc. You can have basically a portion of chicken or fish. It's best if it's grilled or baked rather than fried. So those are basically your protein sources. It is sunnah to basically break the fast using dates. I would like to mention that dates come in all varieties. Some of the larger dates, the larger majul dates, can have up to about 45 grams of carbohydrates. Now, if somebody has 45 grams of carbs, that is equivalent to how many carbs you should be having in an average meal. So if it's a large date, you can basically have all of those through just one date. So for patients with diabetes, that can cause their sugars to increase thereafter. So the smaller dates, however, can have about 10 to 15 grams of carbs per date. So it's best that you take 1 to 2 of those smaller dates, so that you can have the rest of your carbohydrates through either other starch sources like rice, 1 to 1.5 cup of rice, 1 to 1.5 roti or pita. If you like bread, so 1 to 2 slices of bread. And because of taking those balanced meals, you don't risk having high sugar episodes. You can take 1 glass of milk or yogurt as well. One serving of fruit as well along with that. And this is what comprises sort of a balanced meal during Ramadan. And it is expected that one takes this also outside of Ramadan as well. Not just for diabetes, but for overall health as well. So practically speaking, this is what our usual Ramadan plate, looks like. This is what we usually have. but this is how it should look like. You've got your roti, you've got your source of protein with chicken. You have got another source of protein through beans and chickpeas, and you've got your salad along with that. You can have 1 to 2 dates along with that. You can have a bit of yogurt, and that's sort of what a healthy meal would look like. So in terms of physical activity, given the risk of dehydration, it is recommended that one avoids rigorous physical activity, particularly before iftar, because one's risk of low sugar episodes as well as one's risk of dehydration is highest before iftar. Around suhoor or shortly after suhoor, one can consider, moderate levels of physical activity, a light run, just walking. In addition to the spiritual benefits of Tarawih, Tarawih, since it takes quite a bit of time, does require physical activity, it could be considered as a physical activity as well. Finally, when to break the fast, when sugars are too low, when they are approaching 4 or less, or when they're too high, when they're 16.5 or higher, it's recommended that you do break the fast because of those concerns of low sugars as well as high sugar episodes. Some of the symptoms to monitor for in terms of low sugar episodes, one can have tremors, shakes, one can have sweats, heart rate goes up, one feels hungry. But if it persists, one can have confusion, seizures, headache, etc., and then it becomes a medical emergency. So that's why it's important to break your fast if you're having low sugar episodes. In terms of high sugar episodes, one notices, given that they have been associated with dehydration, one gets thirsty, one gets to pee out a lot, one's fatigued, confused, and if it's associated with diabetic ketoacidosis, you can have nausea, vomiting, abdominal pain, and it's important to break the fast in those circumstances. What about some of the medical benefits for those with diabetes? So it was a bit surprising that when you look at data for all comers with diabetes, essentially, Ramadan is a weight-neutral month. Cholesterol levels remain sort of stable. Glucose control for all comers, remain stable as well without improvement. However, this is for all comers. To my mind, the spirit of Ramadan is one of exercising self-control, moderation, and for those, who follow the structured program that comprise frequent monitoring of their blood glucose levels, they adjusted their medications appropriately, took part in moderate physical activity, planned their meals accordingly. It was a pleasant surprise that basically not only did they derive, the spiritual benefits, if you will, of fasting, they also lost some weight, so about 0.5 to 1 kilogram weight loss during Ramadan. They were able to fast with a reduction in their low sugar episodes. And, this parameter that I was talking about, which is basically a 3-month marker of glucose control. So Ramadan ends, as you know, within about a month. But these individuals had sustained improvements in their glucose control up to 1 year post-Ramadan. And these improvements were equivalent to being on 1 extra medication for diabetes. So they were not insignificant. Those are some of the medical benefits for those with diabetes who do follow these structured programs and make medication adjustments and adjustments to their diet and physical activity as recommended. So this is what I had to talk to you about today. And, just to summarize, fasting basically poses unique challenges for those with diabetes. As we have discussed, they can be mitigated through an assessment prior to Ramadan, through planning of meals accordingly, physical activity, through monitoring glucose control, and adjusting medications. It is important to know when one should break the fast, when it's medically necessary. And finally, doing all of this can lead to medical benefits as well, in addition to some of the spiritual benefits of Ramadan. I wish you all Ramadan Mubarak, and I'd like to open the floor for any questions you may have. Thank you very much for your attention.
Thank you very much, Dr. Tayyab. Jazakallah khair. We didn't have anybody type a question, but if you'd like to ask a question, you can raise your hand, and then I'll unmute you, inshallah. You can raise hand button should be at the very bottom. Oh, there is
Okay, so there's a question on SGLT2 inhibitors. Yes. So, given that
could you just Dr. Tayyab, so that those who are on the Facebook can also see what you're talking about, if you don't mind.
Sure. So the first question was about, medications, particularly about a newer class of medications called SGLT2 inhibitors, whether they should be taken or not. So I didn't include medications, because the audience was not medical, but it's an important question. These agents have been very useful in not only controlling sugars but also reducing risks of heart problems as well as kidney problems in those with diabetes. But they do come with a risk of dehydration. So here's what we recommended. Those who are taking these agents, and these agents are Forxiga, Jardiance. So Forxiga is dapagliflozin, Jardiance is empagliflozin, and canagliflozin or Invokana. So those who are taking them and are tolerating them can continue on these agents. It is best that they're taken at the time of iftar because of the risk of dehydration if they're taken at suhoor. If somebody is being started on these agents before Ramadan, we made a recommendation that they are started about a month prior to Ramadan so that they've had a chance to see, how these patients tolerate them. And they're not started, within 4 weeks of the start of Ramadan because, they can increase one's risk of having dehydration during Ramadan. Last point is that most individuals, do not require dose adjustments. However, those who are taking other medications that increase their frequency of urination, so people taking water pills, people who have advanced kidney disease, people who are elderly, we recommended a dose adjustment in those individuals. So those are some of the things that we suggested for these agents. Bottom line is, if you've been on them and you've been tolerating them, you should continue. Consider not starting them within 4 weeks. If somebody is more than 75 years old, has kidney disease, is on water pills, one should consider reducing the dose before Ramadan.
Thank you, Dr. Tayyab. Any other questions? Someone like to speak? Again, you can raise your hand and we can allow you to speak, inshallah.
Since, a question for drugs was raised, I will also talk about just briefly about other medications. So most other medications do not require any dose adjustments. SGLT2 inhibitors, they are an exception. In patients who are well controlled on insulin, we did make a recommendation to reduce insulin by about 30% or so in patients who are well controlled. And if they're taking just insulin once a day, we recommended that they took the insulin at the time of iftar, just because of the risk of low sugars, during if they are taken at suhoor. So that's basically the recommendation for insulin. There are newer injectable medications like, you've heard of Ozempic, Trulicity, etc. They're also very effective in reducing weight, reducing risk of cardiovascular problems, so heart attacks, strokes, etc. But they carry a risk of nausea and vomiting. And as we know, vomiting basically invalidates the fast. So just like SGLT2 inhibitors, we did make a recommendation that they are not started within 4 weeks prior to the start of Ramadan, just because of that risk of nausea. If people have been on them and they've tolerated them prior to Ramadan, they can continue to take them during Ramadan month as well.
Great. That's awesome. Jazakallah khair. Thank you very much for that. It seems like we don't have any other specific questions, and people are not haven't raised their hand to ask anything either. So I think we will leave it at that and conclude this at this point, inshallah. Thank you, Dr. Tayyab, for joining us and and helping us understand this difficult topic and doing such a great job in explaining it. And alhamdulillah, thank you to everybody who attended. I hope this was beneficial and you learned something useful. Uh, with that, we will conclude. Inshallah, we have a few more programs that are coming up on our end. On the mosque side, we have um, the recording will be published on our. It's already on our Facebook page, and it will also be published on our YouTube channel, inshallah ta'ala. We have a couple of things coming up. We have a special program for converts on Tuesday, Ramadan for new Muslims. We have a special program for sisters. That's a series that's concluding on Wednesday. So those of you who are used to that, please join in. And then on Sunday, inshallah, we have a zakat webinar where I'll be talking about a zakat and how we calculate that. So all those things are coming up right here online. So I hope you will join us for that as well. جزاكم الله خيرا سبحانك اللهم وبحمدك نشهد ان لا اله الا انت نستغفرك ونتوب اليك. Thank you again, Dr. Tayyib, for joining us and sharing this with us, inshallah.
Thank you very much.
Assalamu alaikum.
Assalamu alaikum.